Stones less than 5 mm, they can be treated, but with a medical therapy. But maybe 5, you can keep a cutoff value 5 to 8 mm. Okay, so in some instances, stone as larger as 8 mm, they can be treated with a good medical therapy and good hydration. Because the most narrowest part is the vesico-uretile junction. So actually the diameter of the VUJ is 8 mm. So any stone which is the less than 8 mm, that can be treated with a good medical therapy and good hydration as well. So in medical therapy, your aim is to keep the urine output that's greater than 2.5 liters in 24 hours. So encourage your patient to take oral fluids as much as you can. If you can't drink the plain water, so you can encourage the other fluids. But juices and which can, or maybe some diuretics like the coffee and a tea, because they're good they are good diuretics, so they can also be used. Dietary excesses to be corrected. If you should encourage your patient not to take a lot of the protein food, so that there would be less metabolism of the proteins and there would be less generation of the purines. Okay, and then you have to correct if the patient is using spinach or any of the vegetables or sources which are rich in oxalates and phosphates, then they should be discouraged in such patients. And then you can also use specific drugs for certain conditions. So if the patient has actually uric acid stones, which is a common presentation, so what you can do is you can give the patient allopurinol if he doesn't have a xanthinuria, and obviously that would be xanthine oxidase inhibitor, and obviously the precipitation and the metabolism of the uric acid would be enhanced, and this condition will be treated. Other thing is that you have to give a good diuretic therapy, like we use a tablet moderator. That's a good diuretic which is being commonly used in practice. So using a moderator, you can prescribe, or maybe in some instances people also prescribe the Lasix, but that's actually the thiazide diuretic. So we usually avoid these thiazide diuretics, and we avoid the acetozolamide as well. So moderatic is a good choice for that. Then some muscle relaxants like Buscopan or Nospar, so that they just relax the sphincter constriction and the spasm of the constrictor, they would be avoided, and encourage the patient for a lot of the fluids, and just give the antibiotic cover as well, because there is a possibility if there's a stone and there's a stasis of the urine, obviously that will lead to the infective pathology as well. So that's how you are going to treat with medical stones. But sometimes stones are also, we talk about the etiology, so that they may be possible that they're related to some other conditions like inflammatory bowel disease and resorption and jejunal anastomosis, and there's a possibility there because of the enzymatic disorders as well. So you have to, if there's because of the enzymatic disorders, you have to replace the enzymes as well, and you have to go and correct the specific etiology. If there's secondary urolithiasis, then correct the secondary cause. So the main theme of a medical therapy, if the stone is less than 8 mm, that can be passed effectively with a good medical therapy and a good diuretics.